You're listening to The Extraction, conversations on the systems and strategies behind dental practice growth with Colin Ambler and Kyle Bergman. Hello, everyone, and welcome back to The Extraction. We have a very special guest today. We are joined by Dr. Tina Saw, who is the CEO and founder of Oral Genome. But Dr. Saw also has almost a decade of experience as a general dentist and practice owner. Today, we're going to be talking with Dr. Saw about all the things that have to do with disrupting the chairside experience, hearing a little bit about her story as a general dentist, and just kind of shooting the bull about all things dentistry. Tina, welcome to the pod.
Well, thank you, Kyle, for having me.
It's our pleasure. Tina and I were introduced through a mutual friend of ours, Brian Fulmer. So, Brian, if you're listening to this, thank you. It's great to have you on. How are things going with Oral Genome?
I would say we are at a very exciting time right now. We just launched into some major distributors, our largest one being Henry Schein. We're excited about building this medical dental integration that dentistry and medicine has been looking for a really long time. We're excited that we're starting to work with patients and consumers really wanting to know more about their microbiome and their oral health. I think what we're trying to do is really disrupt what's happening in the oral health and also bridge that connection and move it into the medical space. I think what we're doing is something very new that's been talked about. So we've been really busy just executing on everything, I would say.
Love that. And thank you for jumping to the punchline. Recently partnered with Henry Schein. You're crushing it, it sounds like, in every facet. Take us back to the beginning, the starter story. What is Oral Genome? Why did you start it? And we'll take it from there.
Yeah. So, Oral Genome, we are a 15-minute point of care saliva test. We do everything chairside. So, there is no mailing back. And you get this result right away for your patients on their microbiome, their oral health risks. We measure 7 biomarkers today that are related to caries or cavities, gum disease, and diabetes. My origin story, I have been in dentistry for close to 20 years, started out as an assistant, and then eventually went to dental school. Dentistry was something that was not ever something I anticipated. I actually never really went to the dentist until I was having severe pain that ended up into a root canal, an abscess, all this stuff. And my poor dentist had to do something at like 8 p.m. or something crazy because it was like so bad. Long story short, Oral Genome was born because it was trying to solve the problem and the need of patients wanting to have more personalized care and understand what products to utilize, what's going on in their microbiome, how to shift their saliva so that it's more favored towards healthier mouth. And it was also born out of the fact that as a clinician, as a dentist, I was really struggling to have a way to detect diseases really early on. In clinical practice, I was always you get the probing of your gums like 323, 456, and there wasn't anything that was measuring these biomarkers that were leading up to these deep pockets. And I think ultimately patients, they want to do treatment really early. And so Oral Genome was born in the need to solve these problems for both clinicians and patients.
So many dentists I have learned are like third or fourth generation dentists. And it sounds like you were really a pioneer within your family and started from the bottom and got all the way to the top as a practice owner and then decided, I want to disrupt the entire industry, then left your own practice. It's so cool. I'm curious, since this is a podcast held by Team Care Dental. When we first spoke on a Zoom call a few weeks ago, and I quickly showed you Team Care and how we are working with practices and really engaging their team to do the thing better, whatever the thing is at that certain point in time, using automated incentives. You loved it. You immediately got it. Can you talk to us a little bit about why you liked it and some of the pain points maybe that you experienced when you were a dentist?
Yeah, in my practice, we used EagleSoft. and that was the practice management system. We trained our team before the patient leaves have a next appointment, because then it's on the calendar and they'll get a reminder. If they need to change it 6 months from now, they can. And I'm guilty of this too myself, where I don't always schedule my next, and nobody has any intention to forget going to the dentist. We're just one of those professions where people go get their teeth cleaned, get their stuff done, and then no pain. So things must be going well and you don't think of it. But I remember we would pull reports of what we call recall, or patients that have not come in for a while. And I would literally have a highlighter, and my front desk team would just be like, okay, call this patient LM, which is left message. And then we put it on EagleSoft, left message. Then we would do the text thing. We were using practice by numbers, and we were like texting, like, come in for your visit, and wouldn't get response. And nobody really likes also rejection or not having a phone come back. And so, I would see a lot of my team just slowly doing it. There wasn't a lot of motivation. And when I saw team care, I was like, whoa, you like immediately get incentivized for the number of calls or the successes of people, and you're really helping more people that way too. So I'm really impressed about what you guys have built, and like you should hire me as like an affiliate sales rep. But I've been telling people and dentists all about it, and I wish I had this in my practice when I was practicing.
Thank you. Um, and I guess maybe those two paths will cross and we'll take you up on that offer. I'm sure of that. But I'm very curious to hear more about your product. I guess I'm a product guy and my wife's a dentist. And we had that classic husband and wife business clinical combo. And, where I certainly take the business side of this. But I know how hard it is with the team care journey that I've set out on to take an idea and then make it into a product and develop all of the technology of it and then, that's almost the easy part. Going into the market, getting adoption, convincing people to use this, and then have it also be successful results. I think people underestimate how incredibly hard of a journey is, especially when you just casually say, "Oh yeah, I just signed with Henry Schein" as part of my intro. I kudos to you. Like I know what it takes to do that, and I'm very interested to kind of go back a little bit further to hear you were a practicing dentist. What made you have this idea? And what were kind of the first kind of steps? And even tell us some of the hard points of like, I'm sure version one wasn't anything of what it is today is version 50. But take us back to some of the product development. I'd love to hear like the inception of this and where it came from and how you started to develop it into what it is today.
So I would say I was really naive. Like my training was actually dental school, getting my DDS. And so like I knew how to do fillings and crowns and like all of that stuff. Product management is something that I didn't even think would be a hat I would have to wear initially. And so since now we have like a product team that does take care of it. But I took a lot of my own personal experiences and my friends and colleagues' experiences and tried to develop a product for Oral Genome that would work. I was so excited when the product came out. I was like, oh, this is great. We built this experience on the mobile app and all this stuff. And the test is like really quick and stuff like that. And then when you put it out in the field, you realize there's a lot of different practices and there's a lot of different doctors, and all their systems are different. And that, you're very right. Our product version one was a 2 buffer test. And so a lot of doctors were mixing a lot of different solutions, putting it on the test card and then taking the photo. And then if they didn't take the photo right, like then it would shoot off invalids. I mean, it was a very painful and I would say expensive learning experience because we couldn't get some of the offices to work very well in the field than what it was working clinically in the bench with and in our current team. So we ended up launching a product version two, and version two, it was much faster, less files, less confusion. It was one thing that you just mix the whole thing in. And then we really just refined the computer vision because everyone takes photos a little differently. So having a little bit more of checkpoints so that the photo is taken very well to get accuracy of results. The other thing that we learned really quickly was that we couldn't build a mobile app experience that worked for both patients and providers. Patients look for something different than providers. The reports have to be different. The providers want reports that are just here's the lab results, here's basic recommendations, and then they can recommend their own treatment or products or whatever. Patients want a more thorough, long experience where we're walking them through every single step. We're walking them through what products to purchase, what those mean, why we measure, link it to scientific research. And it was very long and educational. And so we actually had to split the experience this year. So when we talk about product management and planning, and we have continually reiterated on the product based on the user sets and the feedback we got.
Yeah, so how long has it been that you've been in the product development of it? I guess when did you start it?
We started the company in 2021. It was
That's
really, it's fast. I
I
feel
think
like
I mean
it's a long time. But when
I
we
of course it does, but I mean, it's like they say every overnight success is like 10 years, and you guys are at the 5-year mark. So I'm actually very impressed, and I know what it's like to feel like, oh my gosh, we're never gonna make it over the hump. But I'm impressed by that. This is an incredibly
Oh, I
difficult
appreciate it.
product.
So there was like, I would say in 2021, we did a lot of like this research. Will this be feasible? Will it work? Will these antibodies work? What are those antibodies for this, for the markers we're measuring for? What is the right type of biomarkers to closely associate with these particular diseases? So a lot of research. And there were definitely a lot of scary moments where I don't think this biomarker is going to be not possible. We persistence and everything. Our scientists did move through, get the stuff that we needed, and it ended up working out for us.
Can you give me a good example of like what's just a really easy to understand? I'm sure you have multiple markers, but give me like a really common case that might just like hit me over the head with like what's something common and what's the outcome, and take me even through what it is today that you're chairside and you get like a cotton swab.
You get a cotton swab. It has this foam piece. It draws out all that saliva in 1 to 2 minutes. Then you put it in a buffer, just what you do for a COVID test. And it has a dropper at the end. You're dropping it on the test card, which has all these wells in there. You take a photo of the test card after about 8 to 10 minutes. And then our computer vision program is running behind the scenes to read that test and semi-quantitatively tell you how much of every single that biomarker or that particular bacteria is in your mouth.
Wow. So is that a mobile app that takes the
Mhm.
picture and analyzes that? And so you had one part of this that was pure like science and clinical related, and then you had to also develop a companion technology
Yeah.
to make this practical and to put it chairside.
Yes, exactly. Well, I mean, and again, I was very naive in the beginning. I was like, let's just create a test, not realizing that we also have to create the software behind it to also
Yeah.
make, which was a whole nother, I would say, another AI, computer vision, machine learning thing itself.
So when did you decide to stop becoming a practicing dentist? And I'm assuming you are, and that you just decided to take this full time and run with it. When was that moment?
Um, about 2 years ago, actually. And I was like, wait, things are picking up, and I knew the technology was working. I also started getting a lot of, I would say, partners, insurance companies. Our team was getting a lot of outreaches from consumer health brands, a lot of different spaces where our test could be utilized. And so then I couldn't take those calls, and I couldn't have my team always take those calls if I was in scrubs doing clinical practice.
Yeah.
And it also required a lot of travel to meet with large partners, sell them on what we're doing, or like convince them on the vision. And so seeing where things were heading, went and took the leap of faith and raised uh quite a number, a couple million in capital. And this I'm all in at this point.
Tell me, like, I'm curious, you mentioned there's a lot of those partners, insurance companies. Why are they so attracted to this product?
I feel like patients are wanting to know more, and you're looking at the rise of patients doing more, I would say, home testing, wellness testing, because they're looking at moving, and insurance companies are doing this too, moving from, I feel like we're a reactive type of healthcare profession. You go into the doctor when you're sick, but people are looking to have something preventative before something bad or detrimental happens. And I also think that COVID had to do a lot with this too, as we saw a lot of also systemic issues too that occurred. And so I think patients, consumers, just people in general are more aware. We spend so much on our healthcare system. And I know that oral diseases is number three on the top of our spendings as to our problem. And people are just very aware. And so I think we're coming onto the market at the right time where we have this technology to help people understand their health better and also help dentists be able to provide early care, kind of start for insurances to really focus more on prevention so there's not these all these long-term big healthcare costs later on.
It's so hard to time the market. It's impossible. You can only hope that you're there. And from an external standpoint, you can thank people like Andrew Huberman who are making advanced blood testing really popular. I mean, the company that he's backing, Function Health, there's Inside Tracker, there's Quest Diagnostics. And I know because I've looked into these things. I am one of those people that wants to biohack my health, and it is so cool that you have trademarked the term decode your saliva,
Yes.
because a lot of people want to live until 200, and a lot of people think that they can, and I may or may not be in that camp too. So the fact that you're giving people a tool also creates an interesting fork in the road for you that I know that Team Cares also has. It's a good problem to have where you have a Shopify site, which I think is very cool, where you can buy an individual test kit for $59, but you also have these massive channel partners. And for us, we have individual dental practices that really see the value in team care. Like you mentioned earlier, we also have channel partners that are using it in a slightly different way, and it's really powerful for them as well. How are you prioritizing these two macro paths that Oral Genome can go down?
Between consumer health and kind of on the dental office side, I know this is something I never really envisioned that we'd be working through two paths. And it's really fun. And I mean, I know that I'm only one person, and my team is fantastic. They're the ones that are delivering upon that. Like, we have our consumer health team, we have our tech team that works between both, and we have our, I would say, dental office, medical office team. And so the only reason why we're able to deliver is because of the people that's behind all of this and the right experience, I would say, that we have really brought in to be able to make this all happen.
I have a question more practically because I've worked in the dental office for 8 years, maybe more, and I presented a million treatment plans. How does this happen chairside with a patient? Are you, offering this before the appointment, after, like, let's just say a random hygiene appointment, you come in and, maybe a doctor has just decided that they want to incorporate this into the care at their office. What's that like for the patient chairside?
Yeah, I mean, we work with so many different offices, from dental service organizations to, I would say, a more holistic biohacking practice to your general practice, your pediatric practice. What we're seeing in general is like a lot of new patients, it's included in part of their exam. It's part of that package that they're going to go in, they're going to get their new patient exam, x-rays, their intraoral photos, and also their salivary tests. It's just they're moving this into, okay, this is the standard of our practice. And patients love it because there's a
Hmm.
reason they're going into that practice. They're looking for a practice that can elevate their experience and help be their advocate for their oral health.
Is it a code? Is it a recognized dental code? Is it something that is accepted by the insurance companies that's covered by people's TPO plans? Is it a out-of-pocket fee? What's it? Give me a little lay of the land on that.
Yeah, so we're considered a biomarker based salivary test. If you go on the American Dental Association's guidance for salivary testing, you can see actually all the codes that are applicable for the oral genome test. What's
Hmm.
very exciting is in January 2026, we did get a new CDT code by the ADA to do salivary screening.
So you're responsible for official CDT code in the world. That is maybe the most
I
impressive
know.
thing that we've talked about yet.
I'm really excited about all the dental offices and all the partners that were really pushing for this code to be approved. So it's official. We're excited for that in January.
So this is a no-brainer. This is like for any office that just wants to offer this to their patients. And if you're an insurance-based practice, I mean, it's a diagnostic code, I guess.
Yeah.
And most of those codes get covered at 100% over those plans. And so if you're a practicing doctor and you believe in this and you think your patients will feel excited by it, that, hey, my doctor is very advanced and they're pursuing this thing. And hey, why not? I'll take a swab and I'll see what it says and it'll give me more information. And I'll have an app, a companion to look at it. Sounds wonderful.
Yeah, I mean, what we do is we'll start recommending to practices in 2026 because I know before you're a new patient, and like I said, I've been a practice owner, you have someone that's calling on all the codes and their coverage and stuff like that. I don't know exactly what the D number code is. It hasn't been assigned yet, but add that so then you know what the patient's insurance is also covering for that. Ultimately, patients want this and we're excited where everything is heading.
It's so cool how you are creating a bridge between biohacking and, I would say, health and wellness and dentistry, which a lot of people don't associate with being fit. But Oral Genome is a technology that is, I think, changing the way that patients trust and engage with their providers. And it's so cool that how frictionless, because we're also looking to disrupt the chairside experience too. And we're really coming at it, we're bookending the experience. You come in more so at the beginning, and we come in a little bit towards the end with treatment plans and incentives and reviews. And we're really tackling different pieces of the same puzzles, which is exciting. For practice owners listening, Dr. Tina, what's the first step that they can take if they want to prepare for this new wave of chairside innovation? I'll call it.
I would say this doesn't take a lot of time in your practice. Your patients will love you for it. And our doctors that do it are just blown away at how efficient and quick this test is. And I would highly recommend that, book a demo with us, contact us. Our information is on oralgenome.com and you can purchase our product, through Henry Schein. And we'd love to work with you. And any way we can do, we will help you out in any way.
I love that. And you actually read my mind because I was going to ask, where can people go to learn more about Oral Genome and connect with you if they wanted to? I know you're on LinkedIn, Dr. Tina Saw, and very friendly, as everyone can attest to if they're watching or listening. Dr. Tina, as we get close to wrapping up here, is there anything else that you want to make sure that our listeners know about Oral Genome or the great work that you're doing?
I had one more question. Sorry. Let's just say doctor's very interested in applying this throughout his or her practice, and says, "Hey, we want to do this." That doctor, let's just say they're running around doing root canals and crowns and very busy. But this would be something that happens like during an exam or maybe like a hygiene visit, right? And so, who do you feel like is your biggest like ambassador during this patient visit? Is it the hygienist that says, "Hey, I think we should try this thing. It's amazing." Or is it the doctor that does it during the actual exam? Or how does this get deployed or distributed throughout a practice like culturally to get it off the ground?
The hygienist and the assistant. Hygienist number 2 is the assistant. I'm blown away with how many hygienists contact us and be like, "We want this to be in our practices." And they push for it with their doctors, and they're very successful at it. We just had an assistant that said, "Hey, I want my doctor to bring this into practice." And then we had one call and the doctor was like, "Okay, sounds good. Let's do it." They're the ones that are actually doing the test. They're the ones
Yes.
administering it. And the fact that they want this for their patients when they could just be, oh, wiping down a room or something, it says a lot. Like, it says a lot about our
Yeah.
industry that people, hygienists and assistants want this and they really care for their patients.
Yeah. Interesting.
If you don't ask them, they won't know about the product and they'll say no. I think we're the most affordable oral health screener that's out there. And even if insurance doesn't cover any of it, we're still a very inexpensive like screening tool compared to any of those blood tests out there or other saliva or urine tests that are out there.
I know it seems to you like forever, but I really think it's a short amount of time that you've like moved mountains. It's really impressive.
Yeah, amazing, amazing, Tina. Before we end, I do want to, give you the spotlight one last time. Any last words that you want to share with our listeners?
I guess the thing is like, please come and try us out. We're really trying to change the world in oral care, and we'd love to work with you any capacity. So that's my call to action.
I love it. Dr. Tina, thank you so much for joining us.
Thank you.
Thank you so much.
Thank you for listening to The Extraction with Colin Ambler and Kyle Bergman. Read episode notes and transcripts at teamcaredental.com.